The surge of the Omicron variant worldwide is impacting travel this holiday season. In the lead up to Christmas, travel was nearly on par with pre-pandemic levels in 2019. On December 22nd of this year, there were actually more travelers recorded through TSA checkpoints than on the same day in 2019. But on Christmas Eve and Christmas Day, that changed quickly when more than 5,000 flights were suddenly canceled worldwide. It was a similar scene Sunday. More than 2,000 flights were canceled and 8,000 delayed. Meanwhile, the latest data shows that the U.S. is averaging more than 164,000 new cases and 1,300 deaths every day. That number is likely higher, though, because of the holiday. That data hasn't been updated. But there is good news. We do have new tools in the fight against the virus, including 2 treatment pills that the FDA authorized to treat mild to moderate illness. And multiple studies reveal the highly transmissible Omicron variant is less likely to land people in the hospital. But the president's chief medical advisor, Dr. Anthony Fauci, warns we should not be complacent.
When you have such a high volume of new infections, it might override a real diminution in severity, so that if you have many more people with a less level of severity, that might kind of neutralize the positive effect of having less severity when you have so many more people. And we're particularly worried about those who are in that unvaccinated class. Even though we're pleased by the evidence from multiple countries that it looks like there is a lesser degree of severity, we've got to be careful that we don't get complacent about that, because it might still lead to a lot of hospitalizations in the United States.
I want to bring in Dr. Tom Frieden. He's a former CDC director and the president and CEO of Resolve to Save Lives. That's an initiative that aims to prevent deaths from cardiovascular disease and epidemics. Dr. Frieden, thank you so much for being here. Let's get into it. Dr. Fauci, what he just said, what are the dangers in getting too complacent about Omicron?
What we've seen is that Omicron is stunningly infectious. I've been working on infectious disease outbreaks for 3 decades. I've never seen an organism that has spread this quickly around the world. But it does appear to be somewhat or substantially less severe. Still too soon to know for sure how much less severe. And what that means fundamentally is we will see new records broken in the U.S. for the number of cases diagnosed per day. That reached a peak last January of about 250,000 a day. That will exceed that within the next few weeks. We'll have to see what happens with hospitalizations and deaths, but we know that our hospitals are already near the breaking point with exhausted healthcare workers, and the number of deaths remains far too high. More than 1,000 deaths per day. That's a terrible toll to be throughout this country, with so many people dying still from a disease that's largely preventable through vaccination. And not letting down our guard means vaccinating, boosting, masking, and then making choices, deciding what matters to you and doing the things that matter most to you as safely as you can.
Well, Doctor, you were just talking about healthcare workers. The CDC just shortened the isolation time for healthcare workers with COVID-19. They can now return to work after 7 days if they're asymptomatic and test negative. So what's your take on that?
The CDC is adapting very quickly. They're getting quick data. Earlier, you could have been critical of CDC for being a little behind in some of their recommendations, but here they've come out quite quickly. They've analyzed the data fast, not just from the US, but from other countries also, which have had many more Omicron cases for longer, so have been able to make more determinations about severity. And this is to make sure that our healthcare system is not going to collapse if we have a huge wave of Omicron-driven COVID cases. It allows the hospitals to be more flexible in having healthcare workers, particularly those who've been fully vaccinated and boosted, continue to work so they can take care of not just the people with COVID, but people with heart attacks, or strokes, or broken legs, or women coming to give birth. All of that is crucial for our society and for our economy and for our health.
You know, some experts are saying we should be rethinking the masks that we're using because the data shows that cloth masks aren't as effective against Omicron. So should the CDC weigh in on this, you think?
I do wish we had better federal standards for what kind of masks work best and what's being sold on the market, because there's still a lot of fraudulent masks on the market. What it comes down to is that most plain, what are called procedure or surgical, those blue masks, most of those are better than most cloth masks. And an N95 mask is significantly better than a surgical or procedure mask. And the N95 masks are particularly important if you or someone around you is immunosuppressed or elderly, and especially if others around you aren't wearing masks, because you need to up your mask game if people around you aren't masking regularly. But any mask that's worn is really important. When we wear a mask, we're protecting others as well as ourselves. And a tight-fitting mask worn indoors when lots of people are present, that's key to staying safe.
Good information, and we're all trying to just figure it out. One other thing that we're trying to figure out, are we going to be having to get a fourth dose of the COVID vaccine? So where do you stand on authorizing that?
We need to look carefully at the data. What we've seen so far is that certain people, such as people who've had an organ transplant, really need 3 initial doses. That's not a booster, that's a 3-dose initial series. And then it appears that certainly elderly and some people at higher risk do have waning immunity, even from severe infection, after about 6 months to the prior variants and maybe sooner for the Omicron variant. So having a booster dose is important. Whether more boosters or a tweaked vaccine will be needed, only time will tell. One of the things that we need to do with this pandemic is to adapt. If we think about what the virus does, it adapts. It figures out how to spread faster, how to spread to more people. We need to adapt. We need to figure out what's working around the world, adapt that here, and use that so we can move forward safely with health, and we can have a 2022 where COVID doesn't dominate our lives or the people around us.
Absolutely. So you must see, every time you turn on the TV, long lines, people trying to get their hands on these at-home rapid tests or getting tests. It's really tough to find. I know I've been online. I can't find one. So how can people tell the difference these days if they don't have the at-home test between COVID and maybe just having a cold or a flu?
It's very frustrating. We wish there were more tests available, readily available, not just the antigen or rapid tests, but also PCR tests and rapid PCR tests coming back within a day. And that's not here yet. We hope that'll be here soon. In the meantime, there is so much COVID out there that I think you have to assume that if you're feeling sick, it might well be COVID, and you should mask, and you should not be around people who are elderly or immunosuppressed or otherwise in fragile health, because you could affect their health. So wear a mask, mask up when you're in indoor spaces in public. That's protective of yourself and it protects others. You really don't want to be spreading something which, even if it only causes you very mild illness, could spread a fatal infection to someone else.
Exactly. You are giving us such good information that we can use. We thank you so much for being here, Dr.
Thank you.
Frieden. Thank you.